Okay.
All right, great. So hello again, everybody. I'm Ann Braus. I'm a geriatrician at UW, and I'm also the medical director of the health center over there at Capitol Lakes. And many of you have maybe seen some of these presentations I've done in the past. Every couple months or so, I do a quick check-in with some updates on COVID-19. And I am so excited that today, for the first time, I think since the beginning of this pandemic, it feels like there's maybe some good news rather than only doom and gloom. So we can go ahead and get started. I will start with a little bit of doom and gloom just to get some updates on kind of the numbers. I think, as we all know, there continues to be these terrible surges of COVID around the country, and we are really still in the midst of this and really in the worst of it so far since March. Overall, right now, we think there have been about 80 million cases worldwide. There have been about 18.2 million cases in the US. And as of yesterday, they estimated about 322,000 deaths, which, these are all just numbers that are sort of incomprehensible. It's hard to remember that these are all, individuals and real people that are going through this. In Wisconsin, we have had about 461,000 cases. And for those of you who saw my last presentation, which was actually back at the end of September, that is about quadrupled since that time. We, as many of us know, have experienced a very significant surge in Wisconsin between October and November. Fortunately, it seems to be on the downtick now, and we seem to be past the peak, although we are still sort of anxiously awaiting what's going to happen after the kind of Christmas and New Year's holidays. We've had about 4,545 deaths in the state of Wisconsin, again, as of yesterday. And in Dane County, we've had about 31,000 cases with 163 deaths. Next slide, please. So this is the number of cases reported per day in the state of Wisconsin since the pandemic began in March. This is from the state public health website. And if you can see here, it starts back at the beginning of March, and we were sort of slowly climbing. And then, Tim, if you push, yeah, there we go. This little blue arrow that I stuck in there was the last time I talked to you all. And we were starting to have this uptick, and we thought, we might be heading into a surge. And then you can see so dramatically how it increased after that into October and November. We kind of hit what appeared to be a peak around mid-November, and then fortunately cases have been trending back down again, although they are still pretty significantly elevated compared to earlier in the year for us. And fortunately, though, there is good news, guys. And that good news is that the COVID vaccines are here, much awaited. And this picture came out on December 14th. This was the first employee at UW Health to get the vaccine. She's a respiratory therapist who works in the hospital and on the COVID units. I'm not gonna lie, I cried when I saw this picture. It has just been, the work of the people in the hospital has just been overwhelming. My husband works in pulmonary and critical care at the VA hospital, and he worked for 4.5 weeks straight over the month of November, in which we saw him almost not at all. He was coming home at 7, 8, 9 o'clock at night every night. He was working in the intensive care unit, working with these COVID patients and seeing just the trauma and devastation. And, so many people have been going through this. So this just couldn't come soon enough. So anyway, next slide. So vaccine overview. So basically I want to spend the next kind of bit of this presentation just talking about kind of the 30,000 foot overview of the vaccine and addressing some of the most common questions that I know I had initially and that many of my patients have been asking me. And then I'll open it up for, whoops, they are showing, try to tap your screen. Oh, sorry, this is okay. It looks like Tim is sending.
Yeah, I'm chatting with a resident to help with the slides, but they're on there.
Okay. So the big picture view here is that we currently now have 2 types of vaccines that have been authorized by the Food and Drug Administration for emergency use authorization. One of them is by the pharmaceutical company Pfizer. This is a 2-dose series, so you get 1 dose, 1 shot, and then you get the second one 3 weeks later. The other one that just got approved about a week after the Pfizer one did is by a company called Moderna, also 2 doses. These ones are dosed 4 weeks apart. These are both mRNA vaccines, which is a new technology, and I'll talk about that briefly in just a minute here. The big question is when are we getting the vaccines? How is this going to roll out to us? I think that's what's foremost in everybody's mind. So basically the country and then states and then local municipalities and then individual healthcare institutions have put together kind of plans using some overarching guidance, and there's sort of a phased vaccine distribution plan because we don't have enough of it to just give to everybody right away. So they're trying to triage the people who need it most first. And these sort of plans have been overseen by the CDC, by the Advisory Council for Immunization Practices, and also by the state and kind of local municipalities. So the goal is to vaccinate those most essential workers and those who are most at risk for severe disease first. We really, got to prioritize the folks who need it the most. So they've kind of broken it down into 3 initial phases that they're calling 1A, 1B, and 1C. And we are currently in phase 1A. Wisconsin got a shipment of, I think it's between like 50 and 100,000 doses of the vaccine last week when they first received it. And so we are trying to distribute that out to healthcare systems. And so we're in phase 1A now. So this means that frontline healthcare workers and nursing home residents and staff at nursing homes are the initial groups that are slotted to get this. So right now, most hospital systems are starting to get this and administer it to their healthcare workers, as we saw in the picture that I posted from UW. And they're sort of going through, it's going to take, they think about at UW Hospital, they think it's going to take about 6 or 7 weeks to kind of get it through to everybody that they want in this first round. And then nursing homes are just starting to get information about dates when they are going to receive this, which is probably going to be kind of mid-January, early to mid-January. This may extend also to assisted livings and other long care residential care facilities if it looks like we have enough, but that's not clear yet. So after phase 1A, which is probably going to take a couple of months, then they're going to open it up to 1B. And this, they aim to include everybody who's over age 75 and then frontline essential workers. So maybe people that aren't in healthcare per se, but are considered frontline. So, firefighters, police, essential workers, I'm trying to think of just in the community in other ways. So like home health workers and things like that. So that'll be phase 1B. And my guess is that that's going to take a few more months. And then after that's done, they'll get to 1C, which will include everyone age 65 to 74, and then others younger than that who are at high risk for severe disease, and then all other essential workers. So folks that are in, public transportation and I think, store workers and things like that. So my guess is that this process is probably going to take a number of months. It may be until late spring or early summer that we really get through all of these phases. And then phase 2 will be everybody else. So the rest of the country. So that's the general overview. Tim, you can move on. So again, jumping to some frequently asked questions, and I stole and then modified some of these slides from the Society for Post-Acute and Long-Term Care, who had put many of these together, which I thought were very helpful, and they want these to be disseminated and given to the public for information. So the big question is, what do we need to know about mRNA vaccines? This is a new technology, relatively new. They've been studying it for cancer therapies for about 10 years. And so we do have some data about sort of overall efficacy of this type of vaccine and safety. But in use for a viral vaccine, this is new to us. So basically, it's complicated, and I had to go back to my sort of medical school textbooks to remind myself some of these details. But the gist of it is that the COVID-19 mRNA vaccines, they through the injection, they end up giving you your cells instructions to briefly make a harmless version of the COVID spike protein. So they basically, you inject this mRNA into the body, it gets taken up by your cells, and your cells get these instructions from the mRNA to create a spike protein, which is a protein that is found on the COVID viruses, but that does not exist normally in our own bodies. So our immune systems then create antibodies that recognize that spike protein, and then they will destroy viruses containing the spike protein, such as COVID, if they enter our body in the future. And two important take-home messages are that you cannot get COVID-19 from the mRNA vaccine. So that is a myth. If you hear it anywhere, that's not true. And then the other thing is that the mRNA vaccine does not affect or mutate your own body's DNA. And this was my question when I first heard about mRNA vaccines and didn't know anything about it. I was like, wait, is this safe? Am I going to be like turning myself into some sort of a genetic mutant with this thing? And the answer is no. This mRNA goes into the cytoplasm of your cell. It does not enter the nucleus, which is where your own DNA exists. It does not affect your own DNA, and it stays in your cells for, I think it's like hours to days, and then it disintegrates and gets sort of eaten away. And so there's no sort of long-term mutant effects there. This is just a visual that I found to help a little bit if you're a visual person, but the mRNA for the spike protein of the coronavirus is over on the left there. It's a molecule that is in the vaccine that gets injected into the muscle of your shoulder. And then that incites your body to create, we inject the spike protein. Sorry, I'm getting myself mixed up. We inject the mRNA, your cells then create the spike protein, which get presented to the into other cells in your bodies, which create the antibodies to it. So if that helps you kind of absorb it a little bit, that's the visual. Moving forward here. So what about these vaccine trials? Who was included in these trials? So these were actually enormous trials. The Pfizer vaccine had over 40,000 people, and the Moderna vaccine had over 25,000 people. Both companies really made a strong effort to try to make these diverse groups that would be representative of, the population in America, and also for people that are most at risk for getting COVID vaccines. So they wanted it to be really racially diverse. So the Pfizer vaccine included 10% Black participants, 13% Hispanic. The Moderna had 10% Black and 20% Hispanic. And they also wanted to include older people, because we also know that older people are higher risk for severe disease from COVID. So 45% of those in the Pfizer vaccine were between 56 and 85 years old, and 23% in the Moderna vaccine trial were greater than 65 years old. So how was the vaccine developed so quickly? I've had a lot of people say, did we trust this? Did it go too fast? This Operation Warp Speed, did they skip any safety issues? And the truth is that no, that this global pandemic allowed us to really rally every resource that we had in the world to put energy into this. And that allowed us to do this much faster than we normally can, create vaccines. So it was a global effort with the world's leading scientists all focused on this single task. We had nearly unlimited resources as far as money and knowledge and kind of the manpower and the technology, and a large pool of diverse adult volunteers. So, everybody knows about COVID, and this pandemic affects us all. So many people lined up to be participants in these studies. So we were able to really recruit many people right off the bat. So what's an emergency use authorization, and what's that safety evaluation process? So an EUA for a vaccine is basically created on the need to use a vaccine quickly to save lives during a public health emergency. So it's sort of an authorization to use this earlier than we might have previously because of the public health pandemic emergency. So an emergency use authorization allows there to be a shorter sort of authorization process, but no steps are skipped as far as the safety evaluation process goes. It's just being moved along and reviewed faster than it normally would be. The FDA assesses that the vaccine, both known and potential benefits outweigh the known and potential risks. And in the case of the COVID vaccines, while most vaccine side effects tend to occur within 6 weeks of vaccination, so that's sort of across the board for any vaccine, for tetanus, pneumonia, anything. we often see side effects of it within the first 6 weeks. And so they made sure to extend the waiting and watching for adverse effects period for a full 8 weeks for both of these vaccines before they would consider authorizing it. So they wanted to be a little extra safe there. It's also good to know that there are 2 separate advisory boards that are, have no vested interest in these, in the pharmaceutical companies that are producing these vaccines, which will review the data and also make recommendations. That's the Vaccine Review and Biological Product Advisory Committee, the VRPAC, and then also the Advisory Committee on Immunization Practices. I'm trying to remember those acronyms. So those are both independent entities. And then, so the emergency use authorization does not imply that the authorization was done too quickly or that the vaccine is not safe. So again, just to reassure everybody that we are confident in the kind of safety of this moving forward. So how effective are these vaccines? This is what has really been blowing everybody's mind, that the initial studies that they did suggest that the Pfizer vaccine is about 95% protective from symptomatic COVID infection, and the Moderna vaccine is about 94.1%. So this is astounding. The flu vaccine every year is anywhere from like 30 to 60% effective. Many vaccines that we have are in the like 60 to 80% effective range, and we feel like that's a good number. So the fact that these seem to be as efficacious as they are is really phenomenal and really uplifting for us all. What was nice too is that they saw very similar efficacy when they looked more closely at people of different race, ethnicity, and age that were in the studies. And so it looks like this is sort of universally effective across all of these categories. So what kind of side effects should we expect from the vaccine? So this is an important thing to consider. You probably are going to have side effects from this vaccine, and that is normal and to be expected. And so I want to reassure everybody that that's part of the process, and that's a good thing. So primarily, you can expect to have short-term discomfort. So most people, if they have side effects, are experiencing fatigue, headache, muscle pain, chills, fever, and pain at the injection site. So a sore arm after you get it. So not unlike the flu shot or the zoster vaccine, the shingles vaccine, if you guys have had that. These reactions usually last 24 to 48 hours, and they're typically more pronounced after you get your second dose. So that second dose that comes either 3 or 4 weeks later. But I want to remind everybody that the side effects mean that your body is actually mounting the immune response that you want to have to this vaccine. So if you're feeling like crummy, it's actually a good sign that your body is doing what we want it to. Excuse me. And then, it sounds like what I'm hearing from my friends who have already got it, you can take some Tylenol and that'll help you feel better for a day or two afterwards and help with any of these side effects. So don't be too nervous about these. So the next big question is, when will I start to be immune from it after I get the vaccine, and how long will I be protected? So again, both vaccines are 2 doses spaced 3 or 4 weeks apart. And what we're finding is that it appears that protection occurs 1 to 2 weeks after the second dose. So you really have to complete both doses to get the full effect. There may be some partial immunity that happens after the first one, but it's limited. And so I just want to encourage everyone that when your turn comes to get this, please make sure you get both doses. Unfortunately, we still don't have the data yet to find out how long immunity lasts. We just don't know. The initial studies that they've done so far followed people for 2 months. That's sort of where we had the data listed to at this point. And so, they're continuing to follow people and monitor this, but we're not going to have the information out probably for a few more months. And they'll continue to, monitor this for years. So we don't know how long protection lasts yet. And it may be the case that we need to get regular COVID vaccines in the future, the same way that we have to get a flu shot every year, that you have to get an updated COVID vaccine. People are tossing that out there as a possibility, but we don't know yet. So, do I still need to wear a mask and keep my distance from others after I get the vaccine? And unfortunately, yes, for a while, at least you will. And kind of the big reasoning for this is that we still don't have data on how long the immunity is going to last, or whether you can still contract or spread COVID without symptoms after receiving the vaccine. Because in the vaccine studies, they were looking at people who developed symptomatic COVID infection after getting the vaccine. And so it's possible that there were people who got COVID but didn't realize it and were asymptomatic and so weren't getting tested for it. We know that happens quite a bit actually with COVID, unfortunately. And so we don't yet, so even though if you get the vaccine, you are likely to be protected from getting symptomatic COVID, there's a chance you may still get it and have a very minor case and not know it and spread it to other people. So for now, until we know more about it, we are still going to have to keep wearing masks, keeping distance from other people until at least enough people in the country have gotten the vaccine so that everyone is considered more protected. And again, that might take 6 months or a year till we can really get enough people vaccinated. Another question, should I get the vaccine if I already had COVID-19? And the answer is yes. We still want people to get it because again, it appears that you can get reinfected with COVID even if you've had it before. It looks like that's for people that it's rare, but people do have gotten infected twice. It looks like that doesn't seem to happen within 3 months of your initial infection. So right now, the recommendation is if you are a candidate for the vaccine and you already had COVID, you want to wait until you're fully recovered from your COVID. Potentially, you could wait up to 90 days to get your vaccine because you probably have immunity protection just by virtue of having had the infection already for at least 3 months. However, I'm sort of the mindset that if you can get this vaccine sooner, get it sooner. There's no risk to you. It's not unsafe to get it sooner than 90 days. And then should anybody not get the vaccine? Well, so far it's not been approved for kids because it has not been tested in children. So I believe the Pfizer vaccine is approved for 18 years old and above. And I believe the Moderna vaccine is approved for 16 years old and above. We also don't have formal information yet on whether pregnant women or breastfeeding women can get the vaccine. And right now, the American College of Obstetricians and Gynecologists is basically saying it's probably fine to get it if you're pregnant, but we just don't know. So you're going to have to weigh the risks and benefits and make that decision for yourself. They're sort of not giving a firm answer on that one yet, but there will be studies. They're doing animal studies with pregnancy right now. And there were women who got the vaccine in the studies who then subsequently became pregnant, within a few months of getting the vaccine that they're following. So we will have information coming out, in upcoming months and years, but it's just not there yet. But the main one is, as far as anyone who really shouldn't get it, anyone with a known severe allergy to any component of the vaccine should not receive it. So if you are someone who has had severe allergic reactions to things in the past, you want to make sure you're aware of what all of the components of the vaccine are, all of the preservatives and things. And if you know that you have an allergy to any of those, then it is advised that you not get that. Are there any more questions? I will say I haven't gotten the vaccine yet. A number of my coworkers and friends have, and I'm seeing all these pictures of them. They're posting on Facebook and on Instagram, the selfies of them getting the vaccine, and it's wonderful. But I am so jealous. I cannot wait. I'm guessing I'll get mine hopefully in the next 1 to 2 weeks. And my husband just got his this morning, which I'm thrilled about. So
that's exciting. Good to hear. We have one question that was chatted in, and then the other people can ask questions.
Sure.
Do the vaccines reduce viral load in individuals and therefore lower the likelihood of transmission? And by how much, if yes?
That's a great question. And I haven't seen that mentioned specifically. So I'm not sure that was an outcome that they were yet looking at for people. So that probably is going to be measured in the future, but it's a pending question right now that we don't have data about. The initial studies were really just, did you get COVID with symptoms or didn't you?
Okay. Okay, so now we'll go to other questions people have. If you want to raise your hand.
I have a question.
Okay, Joe, go ahead.
When is your guesstimate that we regular residents of Capitol Lakes in independent living will get the vaccine? Your guesstimate.
Yep. I'm going to say optimistically, maybe March is when this will open up to phase 2. Phase 1B. So 1A again is just where we're at right now, which with the healthcare workers and nursing homes and maybe assisted livings. And I'm guessing that is going to take 2, maybe 3 months to get through, and then it will extend to phase 1B, which is anyone 75 years old and up is the plan right now. So this is exactly as you said, a guesstimate, but I'm going to say March.
What did you say?
March. Okay, I have a question.
Go ahead, Jean.
Okay, yeah. We have never been tested, okay? We've never had to be or not had symptoms and that kind of thing. Now, what happens if the day of the vaccine, do you take temperatures at that moment? Is there anything that says, what would happen if somehow you had the beginnings of the virus, okay? Were you still able to get the vaccine? Does it interfere with what the vaccine will do?
Yep. So I would say if you're feeling normal, go ahead and get it. If you're having symptoms of anything the day that you wake up and are scheduled to have the vaccine, I would actually recommend that you check in with your doctor, consider a COVID test before you get the vaccine. I would bet that there's not that it wouldn't be unsafe to you per se to get the vaccine if you are also developing COVID, but again, we just don't know yet. And then we don't know kind of what your body's immune response might be if you get the vaccine and you also are evolving the infection at that time. Another interesting question that the hospitals and the nursing homes are trying to anticipate what to do is, if everyone's getting body aches and maybe a mild temperature for a couple of days after they get the vaccine, how do we know if that's from the vaccine or if that's because they just got exposed to COVID within the past few days and maybe they're actually developing the infection? So we're kind of putting together protocols in which we say if you develop any symptoms within 24 to 48 hours of getting the vaccine, or if you develop any symptoms, I should say, within a day of getting the vaccine, it's generally okay to monitor for 48 hours before needing to get a COVID test. However, if the symptoms last longer than 48 hours, that should prompt you to get tested. Or if you have symptoms that go above and beyond what we know to be associated with the vaccine. So the vaccine should, body aches, maybe temperature, maybe feel weak or tired, but it should not cause cough, and it shouldn't cause congestion, and it shouldn't cause the loss of taste and smell or major GI side effects, which are symptoms of the actual COVID infection. So if you have any of those would actually prompt a test even sooner.
Thank you. Great.
All right, Pete, you can go next. Oh, I don't.
Yeah, with the rollout of the vaccine, I'm sure they're not coming at the same time. I was wondering if we had a choice, which would be when they were offered, how do we know, you might be symptomatic or prone to complications from internal aspects of the vaccine. Are we offered a choice, or just get whatever we have available?
My recommendation would be to get whatever is available. The safety profiles of both are very good and pretty similar. The number of people experiencing kind of these mild side effects was, it was like in the 20 to 30% kind of for both of them. So many people are getting some mild side effects regardless of which one you get. And the number of people that get severe side effects was like 0.9% for one of the vaccines and 0.6% for the other one. So very, very rare that anybody gets sort of a severe reaction that causes them to go to the emergency room or the hospital. And so I think right now the most important thing is to just get a vaccine. And I think it's probably not going to be a choice for most of us, because I think it's going to be in limited supply for a long time. And so whenever your turn comes up that you can get one, get whichever one is being offered and just go with it would be my recommendation.
Okay, and as a follow-up on that, I know the Pfizer vaccine is supposed to be kept at a certain negative temperature, and will that cause any problem for us here at Capitol Lakes?
I don't think so. We are partnering with pharmacies who are equipped to have the like negative 80 degrees Celsius or Fahrenheit. I don't even remember. The Pfizer one, you're right, is the one that needs to be even colder. But the pharmacies that are ready to administer it are prepared to do all the storage needs that it requires. One other thing I was going to say to follow up on your previous question, we do recommend that you make sure you get the same vaccine for the series. So if you get the Pfizer one for your first shot, you got to get the Pfizer one for your second. If you get Moderna first, you get Moderna for second. So don't crisscross. And that's probably not going to be an option, but we're just trying to make that clear that that is how it should be.
Okay.
Thank you. Other questions? Oh, Alan, go ahead, unmute yourself.
As an aside, before my question, I got a call this morning from the son of my best friend who told me that his father, who was in a retirement home 2 miles from NIH Bethesda, died from COVID. And I'm still reeling from that, but and he was exactly my age, which is 90.
Sorry to hear that, Alan.
My question is, I read in the newspaper about 2 weeks ago that the procedure when they come into a retirement home is to, rather than have everybody get in line somewhere, they go to the rooms individually. Is that the way they do it? They actually go to where the people live and they knock on the door and they go in and give you the shot.
It depends on the facility and what they're able to accommodate and kind of the functional status of the people that live there. You know, if it's an independent living or somewhere where, you know, people are really able to get out and walk themselves down to a place where they can get the vaccine, then that might be the case. But if there's an active outbreak at the facility and they want to keep people separated, they may make an effort to try to do it individually and go room to room, because that might be a safer way rather than having people come through in a line, you know, in a big auditorium to get it or something. So it really depends on the resources that the different facilities have. And I think everyone's going to approach it differently, but with safety in mind, because again, we still need to keep people distanced and wearing masks and all of these things, even as we try to administer this to large groups of people.
I know for here, Walgreens, who we're partnered with, is setting up a clinic, and they'll do it in the Grand Hall. They asked how many people are bedridden, which is 0. So they want a clinic, and they have a map and everything, how it's all supposed to be set up.
Good. Thank you very much.
Okay, other questions? Anyone else with a question? MJ, you can unmute yourself.
This is tangential. News in the paper this morning about a test that the state is making available to us that's a swab in a saliva swab. Like Jean, I have no symptoms and I have not had any kind of a COVID test. Are you recommending that we go ahead and ask for that?
Is this, can I ask, do you know, is this just a test for active infection?
Yes.
So I would say no, that okay. If you're feeling fine, there's not great utility to just sort of going in and getting a test. It may be the case that in upcoming months, there are rapid tests that are readily available that, you know, a place like Capitol Lakes or a school will just have, and every day, everyone's going to get tested and see, but okay. We're not at that spot yet. And so for now, I don't think there's utility in someone like you who's feeling fine and, you know, taking your precautions to get tested without symptoms.
Okay.
Exposure.
Yeah, the only reason I ask is because when I do end up having like a mammogram or that a flu shot, they say, have you had a COVID test? And I have to say, no. And so I was just checking on this. Thanks very much.
And I think that question is more screening to make sure that there's not people who had symptoms and got tested and are still waiting for results to come back, and meanwhile thinking it's fine to go out into the community and do things while they are waiting. So if you have a test because you've had symptoms or exposure or concern that you may have it, please stay home and don't go anywhere until you have that negative test result back.
Other questions we have out there right now? Royce, go ahead.
Okay, can you hear me?
You
Yes.
can.
Oh, okay. I am a little disappointed that we have to wait until March. I thought it was going to be sooner. What happened? Were they not organized, or they didn't produce enough vaccine for us? I'm a little puzzled about what happened. Because
Yeah, no, that's a fair question. I think all of our minds are going there. No, I think the process has been generally good. It's just that there's, it's a product that has to physically be made, and the entire world is asking for this. And so countries for many months have been sort of bartering and bargaining with the companies to like reserve their shares and how much can they get, and it's going to come in certain shipments, and the supply chain, do we have enough of the preservatives and the factories to make it, and are people too sick to go to work in the factories because they've got COVID? And so it's all of these complexities, and so it's actually, I think, rolling out still on the schedule that was anticipated, but we just knew that we can't make 12 billion doses of this vaccine to get 2 doses in everybody in the world all at once, as much as, gosh, that would be great. So I think we just have to wait our turn as it's being produced and take it as it comes. There were some hitches, I know. Yes, a little bit, like Wisconsin. There was one of the overseeing folks for the distribution from the federal government made some calculation errors. So some states got a little bit less than anticipated. And unfortunately, Wisconsin was one of those states, but I don't think that's going to affect us long term. We are still receiving what we need. And again, having to give it, there's a lot of consideration about, from the public health standpoint, who needs it the most, what is equitable, who's the highest risk, do we want to reduce death or do we want to reduce spread of the disease more? And so it's so complex in all the decision making. And so right now, you're right. I think we're all disappointed. I would love to get it to everybody right away, but the truth is that they are getting it out as fast as they can, and we are receiving it and distributing it as soon as we're able to.
thank you.
Other questions? Leon, unmute yourself and go ahead.
There we go. Can you hear me?
We can.
Okay. How much, I have read that the Pfizer vaccine comes in vials and you sort of have to decant it and mix it with something or other. Is that true, or does it come with like already needles set up, or what's the process of getting from what you get from the company and what you put into the patient?
I will be honest, there's a lot of information about exactly how it gets drawn up and administered, and I have sort of glossed over those details because that's less my role and more the pharmacists and the nurses who are administering it. So in all of the onslaught of information that's out there, that's one area I didn't focus on specifically. I do know, they do with any vaccine, it comes in just a little vial. I don't think you often have to mix it with other things, at least other vaccines you often don't, but I don't know for COVID if there's any mixing and matching that happens. I believe it's all in the vial, and there's usually about, I think, several doses in one vial. So they take a clean, sterile needle, for each patient and suck up the aliquot that they need and then inject it into your muscle. And then they throw away that needle. And then the next person comes up and they take a clean needle and they put it in there and suck up the next amount and put it in. So I did hear that there was some interesting that they were discovering that they had little extra amounts left over in the vials after they had administered like the 5 doses that they thought were in there, that there's always a little tiny bit extra. So they were looking into seeing if they could combine those and utilize those to vaccinate more people, because we don't want to waste any of this. It's worth its weight in gold. And so I think that there was groups of pharmacists that were looking into whether they can sort of batch these tiny little leftover bits and create more doses that way for people to enhance access to it. And I believe that that was approved.
I actually was on a webinar and they described how to do this. And you, for the Pfizer one, you use 0.3 of the vaccine and then a diluent of, much larger. And then you mix each, you have to mix the Pfizer one. So
Tim's an expert then. Thank you.
yeah, for some reason I know that.
No more than I do.
Okay, let's see. Other
Me.
other questions?
I do.
Okay, Jean.
Just one. I thought I had read that the Pfizer product has to be slightly warmed after it's taken out of the freezer before, at just a time. So it isn't, but nothing moved about it, but something that has to be a little bit not as cold as it comes out. So that's what I had heard, but.
Yeah, it had to get to room temperature. That was one of the things. I think I was on the wrong webinar. I learned a lot about stuff I don't have the license
Okay,
to do.
I know I'm going to the right place. Thanks both. Thank you.
Other questions as we wrap this up here? I don't see any. Okay. Well, thanks for joining us. Residents, Dr. Braus, thank you. Appreciate your time today, and we'll do something like this again, I'm sure. Did you have a question, Harold? No, just a wave. Okay. I hope everyone
Ted,
this is your holiday. Merry Christmas. Yeah, who has a question?
Ted, can you hear me?
Yes, George.
George. Can you
Go ahead,
get me? Ted, can you get me?
I got you. Go ahead.
Yeah. My question is this. I'm looking a little ahead in the future, so to speak. Now, when we go in for the shot, are records being kept of us?
Yes.
Yes. Both
Okay.
Capitol Lakes may well do individual records, and then will do individual records. And then there's also a Wisconsin immunization registry. So everybody who gets the shot will get entered into a statewide registry that can be accessed by medical providers to review.
Yeah, when we have the date for the clinic, we're going to deliver paperwork to everyone's apartment, and then you're going to have to fill it out. And your Medicare information will be on there, and then they'll use that information to submit it to the immunization record as well. So Walgreens is going to handle all that for us, and then you'll be able to get a record of it if you need it.
Yeah, I keep seeing they're taking. I see the age limit up to 75, and then I see what up to 85. What about those of us who are 85 to 100?
You're in the 75 and up.
Yeah.
Oh, goody.
I hope it makes you feel younger. Okay. All right. Thanks, George.
Everybody, and I just want to encourage you all. This is wonderful light at the end of the tunnel, but we're not there yet. I feel like this might be kind of the home stretch that maybe by next summer things will start to be feeling more normal and we'll get people vaccinated. But don't let down your guard yet, especially with the upcoming holiday. We did have this significant surge in Wisconsin that now is on the downswing, but COVID is still very much there. The hospitals are still very much full. So please continue to stay safe, and we'll all get through this.
Thank you very much. Take care, everybody. Bye-bye.